talked about Portugal at a podcast we did a while back.
Yes.
And I had a friend of my partner who got married in Portugal.
Yes.
And you said before I went on the trip, hey, why don't you just go visit some of the sites?
Yes.
And I took your advice and I did. And why don't we have a talk about it for the first time?
Amazing. That's a great idea.
Great idea. Yeah. So I went to Portugal. I went to Portugal last week of August. I went with my wife and we left our kids here.
Oh.
And it was an amazing trip. The only problem with the trip was that I really enjoyed it. And
right here in Canada, you didn't leave your kids here specifically, but in Canada.
Yeah, I didn't leave them with you. No, I didn't leave them with you.
Just so you know,
and your dog.
My
and your
childcare services are not that
well
respected.
No, my mother-in-law came down for the week,
nice.
Thankfully, and she took care of them. And
good. So how was it?
It was a good trip.
Okay.
Beautiful country, although I only visited like 3 or 4 cities. And I did have one day where I visited the sites. So a colleague of mine who's an addiction medicine doc went down there maybe a year or 2 ago, and he was just like, he was really impressed, but he did more of a 2-3 day thing. He saw a bunch of the sites. He met with the police. I think he has one picture from where the police and the addiction treatment, they were all at the same site working together on how to help people. And he connected me with this psychologist who helps run one of these nonprofits there. And they must have this happen all the time because it was a week before I sent him the message. He asked, what days might work? I said, these 3 days work better. He said, I'll let you know. Then he gave me 3 Google locations on Google Maps to go and visit on a day. And so on one of the days, I took the Uber down, and then I got a ride to the second site, and then I walked to the third.
Okay.
And the first site was really just in the middle of the street. It was like, and then I saw a little bus.
So is this the bus here we're looking at right now?
Yes, yeah, that was the bus, but that was after the clinical care was done.
Okay.
But it was a special day. I think it was on International Overdose Awareness day.
Okay.
And so they had 2 buses. So one bus had a safer consumption room, along with a bunch of harm reduction supplies. So over there, naloxone is not free. They have very limited naloxone. They can't just sort of hand it out in general. But on this day, they had it to raise awareness. And these really nice packaging for these kits that are there as well. And then they have their methadone van. And so in Lisbon, they have 2 methadone vans. They go around the city at specific times and have specific stops. On the team, they'll have a psychologist, a couple social workers,
and
a case
who we're
manager.
Looking at right now?
That's the van, yes.
Okay.
That's the van,
But the people in front, those are the
healthcare providers that are there.
And that team of would be consisting of a psychologist, you said?
Yeah, the psychologist is the one that runs but they're the supervisor of that site locally. And there's social worker, case manager, and then there's I'm not for sure it's a pharmacist. I think it's more of a technician that'll administer the methadone and stuff. And this is the low barrier program where they go to all these sites around. And then once you have a level of stability, you go down to the main hospital for your care, right? And so once your life is a little less chaotic, you can come consistently on a certain number of days, and then you would go there for it.
So I'm a substance user in Lisbon, and I see this bus, and I can just, do I need an appointment to go there? Can I just go up to the bus?
You don't need an appointment to go there, but if it's your first visit, it takes time. It takes some time to do the assessment, figure things out, what to offer. They do need one urine screen. They don't regularly do urine screens, but they need one thing that shows that there's opiates in your system, so they're not just starting it on somebody who's opiate naive. And then they'll have to confirm with the psychiatrist. So North America is unique, where psychiatry hasn't historically done addiction medicine care. But if you go to South America, you go to Europe, psychiatry does both, right? They do addiction and they do mental health. And so they'd call the psychiatrist and then get it started. I think we had one patient who was restarted that day. They called and got it set up, and it was provided there as well.
Okay, interesting. And this is so this is kind of like the I guess the outreach for the hospital. hospital. Like it's connected on the same
I mean, that's the way that I
system?
understood it. Yeah, that's what I understood it was. I mean, but it's the same, but it's not the same. So they still have to call in. They had to confirm this, confirm that, when the last dose was, anything else medical, all those things are going on. And every now and then they'd have different initiatives where they could do like blood work or like connect hep C treatment and things like that. It's really impressive. I mean, the bus has been there for at least 20 some years, I think, from what I understand. The colleague that I met, one of the psychologists, she'd been there since I think 97, 98, doing that kind of work.
And do I have to pay any money for this service as a resident of the city? And
No.
Okay.
No.
All right.
I mean, they do have gaps as well, and I think for all of us that work with patients that are dying, we wonder what's missing, right? What's missing? And so for them, they're like, we need more naloxone kits. We don't have naloxone kits, right? Or we need there's always the need for more things because usually there's a certain subset of people that we're not able to capture or help.
Okay. All right, that's interesting.
So I went down there, and it was that overdose day, and oh my goodness, they were so kind. They just went through all the things, and at the end, I wasn't going to take a picture, but they're like, "Oh, would you like a picture at the end?" I'll just take it, and then they had the staff line up, and they said it was fine, and so I took the picture there. They took the picture with the staff, and they were just so. Yeah, just so helpful. And you see they just really cared about the patients that were there as well. Yeah. So we went there, and then the psychologist, she drove me down to the safe consumption site.
Okay.
And the safe consumption site is a newer thing, right? So that was probably around 2019 that it started.
And that's what we're seeing in the next picture here?
Well, that's the safe consumption room. I didn't take a picture of the building. And
okay. But that's they the room when you get in there? Yeah,
when you get in there. And they said this is a place that was in what they called the trafficking area, but it's a drug trafficking area. So that's just an area where there's a lot of drug trafficking that's occurring like outside and in that area, and that's where the consumption place is.
Okay, that's interesting to me. So there's the drug trafficking area. So this is where you can buy and sell drugs with impunity?
It's known to have people that are trafficking drugs. I'm pretty sure the laws still apply.
But generally speaking, there's money changing. Like when even you're walking through, you're seeing people that might be doing that? I
didn't see people that are trafficking. I probably saw people that were high in some way.
Sounds like such a dark word. Let's say,
but I think it's the translation, right? I think it's that's why, because they didn't know what they were saying at first, right? They're saying trafficking, like I'm going to assess trafficking this, because we don't use that word here, but I think it's just how the way they was translated from Portuguese to English. It was just the word that they used.
This is where somebody who has drugs is helping out someone who doesn't.
Yes, or selling it. Yeah, that's exactly it.
Just trying to think of a more
empathetic. Yeah, empathetic. Yeah, I mean,
patient-centered.
But anyways, yeah. So I mean, that was the area that it was in. And the building was actually really nice. I didn't take a picture of the building. I just took a picture of the room. But in the building itself, they have like a check-in desk that's there. They have certain rules where at certain times that you can sort of be there at. They had a regular smoking room, cigarettes to hang out. They also had a little lounge where you could like watch TV as well. And they had 4 or 5 showers, right? That seemed very like just they look like good showers that you could do, shower, change. They had a room full of clothes, tons of clothes, right? So they had like, jackets, pants, like shirts, stuff like that. That was there more for the clients that were coming in that people could donate, and have there as well. They had a back room where the staff hung out. So there's a couple of psychologists back there. They had like a small coffee machine and a little area to sit. And then they had the 2 consumption rooms. And the picture that we have, this is more for the injection and drug use, but they also had a smoking room beside it as well. I didn't take a picture of that as there was like 6, 7 people in there. And it was interesting because the social room was actually, the smoking room was a social experience. It seemed like it was just 5, 6 people. They would come. It was almost like they were chatting, talking. It was almost like a good, I don't want to say good vibe, but it was like a good place to be. And then there was the other room with the injection. There wasn't anyone using at the time when I was there. And they have the observation space that you can see it as well. They have a lot of education stuff there as well, and the psychologist was the one that was there, but there was also someone who's training to do the social work degree, and he was doing a lot of the education around the different items. It really reminded me of like what you would see like in a diabetes clinic, where they have these educators as information, safe for consumption, all that stuff. And it was interesting in terms of the number of overdoses too, right? Because what do you have at a safe consumption site in Canada? Like each site, how many overdoses a day? There they had about 40 in a year. right? So 40 overdoses in a year. And we talked about this in the past.
Yeah.
Because they don't have fentanyl.
They don't have fentanyl.
And everybody I talked to was like, thank God, we don't have fentanyl. We wouldn't know what to do.
Right.
We wouldn't know what to do or how to handle it. Thank God. It's just, it's like heroin and crack were the two things that we were seeing there.
Okay, so interesting. So they got those wraparound supports. You can have a shower there. You can get some fresh clothes. You can, and then if you wanted to talk to somebody, you're saying that there's a psychologist that the people are perhaps better trained than what we have, but the model seems to be focused on people that are trained well.
Yeah, I mean, they also said, like one of our gaps is we don't have lived experience yet, and so I don't know what kind of administrative or hurdles and stuff that they have to go through for that.
Yeah,
but that was they identified that as one of the gaps from their program.
Okay, so but if there's better support than what we have in Canada as far as being able to go talk to a counselor if I wanted to, or a psychologist.
Yeah, I mean, it's tricky because the social workers, the counselors, the case managers are quite good. They're quite skilled. I don't know why the psychologists are like, well, that's like, I mean, I don't think we have a psychologist on my team in the hospital I work in.
And we don't have one on my team.
Yeah. So, and there just seemed to be normal just to have I met 4 psychologists that day. Right. And they all had different roles in different places. Some more patient facing, some more administrative and program design and so forth.
Okay. Interesting. So the illegal, I mean, when we did our earlier talk, which we'll post in the chat here now, as far as our earlier talk on Portugal.
Yeah. That's right. We're at that level. Yeah. We can
point at that.
Point at old talks that we've done.
The big thing about that takeaway from that is this not legality. It was decriminalization, right? That's the word for the model.
Yeah, I think it was decriminalization. And what we read was that you have a very small amount for personal use. You get a lot of trouble if you sell it to minors or give it to minors. You're not allowed to deal it. And they sound to make some effort to stop it at the borders.
Right, and where I think they drew the line was that they're going to sell it. It's decriminalized, but they're not supplying it, right? So
and it's not legal. Yeah, it's not legal. It's not like cannabis stores.
Right, where in Canada we've taken the step further of getting in the business itself and making money from taxation and what have you, right? Because it's right. So we're very much in the business of promoting it almost.
Yeah, and so the consumption side is there. I think there's another one that's either opening up, but they have the same problems where in certain neighborhoods they don't want it, and it's like a lot of politics and this and that around those things too. But it was just nice to see. It was nice to see I never thought I would say this. Yeah, it was just nice to see a smoking room. I don't know. Yeah. It's one of those things where when you have somebody coming in regularly, you can stack on so many other supports to it, right?
Yes, absolutely.
Whereas if somebody's in hiding and they never connect with anyone, who knows, No,
100%. I mean, that whole wraparound model, I mean, that's what even if, all the different services that are coming out. I mean, even when we talk about our RAM clinics right now, trying to add services to that, right? So what we've, at St. Mike's, we've just come out, not just come out with, it came out a couple of years ago, but we're remarketing, I think it's called our Pathways Clinic, which is a psychiatry clinic for people that have been to our RAM at least twice. Then if it's warranted and there might be some comorbidities and some reason to do this and some interest on the patient, of course, then we can connect them with a psychiatrist that would be seen 1 day a week. So and we're using that. I mean, I don't know if I think it's a great thing to have it because otherwise to get a psychiatrist is really hard, especially for our population. It's actually almost impossible for our population.
Is it,
Yeah. I don't know how. I mean, that's what I do, and I don't know who to hook them up with.
Okay. No. I mean, I guess I don't fully appreciate it because I work in an addiction clinic, and when they need psychiatric care, I just offer it. Right, I just set up another appointment and I see them for longer, and I do it.
So you may have an informal Pathways type clinic arrangement.
That's only because I'm a psychiatrist by training. But you're right. Like to get that referral and then to get the person to show up, it's a whole other ballgame.
I mean. I know a lot of psychiatrists, including the one I'm sitting with here, but I probably know, I don't know, like a dozen of them now at this point. Do I know how to hook a patient like that with one? No. To see me, you have to have been at the hospital I work at. Yeah.
And you have to be seen by me while you're there. and then you'll get an outpatient follow-up with me.
So it's a very specific criteria even for there, and that's fine. I'm not, but what I'm saying is that having that extra service, I think, is a good plus.
Yeah, no, and I work in another place as well, and I thought I was going to do addiction medicine there, but like, no, it's psychiatry is the gap, and that's what we need. We have places to send for addiction medicine.
Yeah. So any other takeaways from Portugal that, that we can learn from or that you found interesting?
Yeah, I mean, the big thing really just was the fact that they have these highly trained professionals that are there. They're heavily trained in research and evaluation. I think psychologists are in that lens. That part was interesting. And it felt more almost like a diabetes model of education, at least in Lisbon. I heard up in the north, it was much more you can use whatever you'd like to use. You don't want to use, you don't have to use. Whereas where I was more like an education kind of thing. And then the other spot that I saw was also interesting. I saw a building that was a COVID shelter or with a safe consumption space there as well. And
is that where this artwork is from?
Yes.
Okay.
Yeah, no, that's where it's from, and it's one of the persons that was there, and it's in the building in one of the rooms that are there as well, and it's describing some of the events around.
So this artwork is from the clients of the service.
One of the clients of the service, and
very talented, very talented client.
Unbelievable, yeah, unbelievable. And it was done during the COVID time, because COVID time was very unusual, right? Like all of a sudden, all social connections were taken away. It was a very upsetting time for everybody, and more so for those. I believe that use drugs, I think, was devastating for them. And so you just see some pictures. You see the common area in the middle. I mean, the way it was designed as well is almost like this square rectangle building with an open thing in the middle. What do you call those?
A courtyard?
Yeah, courtyard in the middle. They had a small area where they had a bunch of rooms or offices for the staff. They had a physician's room or a nurse practitioner's room, and then they had a nurse's room and a medication dispensing area as well. And then they had 3 consumption spaces. They had a smoking area, they had a injection area, and then they also had a drinking area as well. And you don't just keep all the drugs with you. You have some kind of a deposit thing. You put them in that box, and then when you have to use, you come and get it. You use your stuff, then you put it back in there when you're done. And it's really closely monitored by nursing staff, or maybe they're more social workers. I can't remember.
Yeah.
And so it's they really do a lot of education around stuff. It was interesting because the smoking room was very different, right? It wasn't the social atmosphere. It was more like individual tables. You were allowed to go if you were a couple, but this is all because of COVID, right? So they're very concerned about COVID, and so they had the spacing and stuff there too.
Now you talk about education. So that when I think of education, I don't know. I think of it being, in this setting, for some reason, I just have this coercion type model of it. Was there that vibe, or am I wrong?
I mean, the thing is, I don't think they would ever deliver it like this. When I spoke with these people, they almost had that whole, I don't know if you can say that harm reduction, maybe a bit of MI, but more harm reduction energy.
Okay.
They also had that destination in their mind, I think, where they wanted to make sure you knew how to inject safer. They had a bunch of those pamphlets very similar to the KD stuff that we would get here. Like the similar colors, right? This is safer, this is less safe to inject here.
So the vibe, what you're saying there is the destination in your mind is the destination that they've used in the most safe way possible, or the destination is they're not going to use anymore? No, the destination is that they're aware of how to use safer and the risks of using. All right. Right? Like, so it's not that disappointment that they were able to find the vein. It's that's what you wanted to do. We did it well, and you did it with a clean needle, and you're all good to go. That's a good thing. That's my gut. But I didn't ask them if they coach on how to find a vein. I suspect that would be part of it. Although most people know their bodies better than the clinician, right? That's seeing them. I just because for maybe part of it was that it was also National Overdose Awareness Day, and I attended a session where they're teaching people about overdoses, and they were talking about overdoses, and it's just so. I mean, it's worse here, I think, because of the fentanyl, but the amount of people that have seen people die is just
just hits you. But at the same time, I think, they're partially because Narcan's not fully available. People are open to learning and seeing, well, maybe I can have this, maybe something that could help, and whatever that is. It just felt more like an education thing. They also had a common TV area. They had a large meal place. Initially, when they designed it, they planned on having the people who lived there to help sort of cook and participate, but something like safety thing came up and around the piping where they couldn't do that. And they also have a floor that's more around education. They'll have courses, job retraining, resume prep, things like that.
Oh, great. Okay, so if I want to get my shit together, and that wraparound service even went to that's amazing.
And it's not like mandatory and stuff. And then they'd have two areas: one for women alone, one for men alone, and then a small couples. A certain number of couples could be there as well. Did have a small number, like for the ones that were drinking alcohol regularly. They also had a bunch of pills available too. So in the main hospital, they were doing this managed alcohol program where they're giving people folate, B12, B1, all these multivitamins, plus a little bit of Valium and stuff, and a little bit of antipsychotics. And part of it was that I can't remember, but there's only certain hours where you have access to alcohol, and then they don't want you to withdraw and stuff in between those times. And my memory is off. I can't remember if it's overnight that you don't have access to your alcohol, or it's just during the day, or if you have to leave for a little while and then come back. I can't remember the rules. And they also had, I think they only had a certain number of spots, and the wait list was quite long to get into this building.
Okay.
And so if you left for a couple of days, you're at risk of losing your thing. If you're say if you need like medical detox, they would send you to the hospital. Like if you were super sick in some way, but then you'd have to come back in some way. I mean, I can't remember all the rules, but everything that they had was done with intention. It sounded like it was really this complete place of compassion with a harm reduction as being the primary goal. And then for those that wanted to shift, giving them a pathway out.
And was it, so just the fact that you said the medical detox, so did you get the sense that there was that cohesion between these two services, that if somebody absolutely needed medical detox, it was available for them in the hospital? Did you get that sense?
I got that sense. I didn't ask about it explicitly, but I know there was some kind of a partnership because they were running a managed alcohol study sort of in the hospital with trying to cover their withdrawal symptoms. Right. They had the medications at the facility I was at as well.
Well, that seems like that's a step forward from what we've got too, right? We don't have medical detox is very difficult to get.
The challenge, AP, is all this stuff that I was seeing seemed like a step forward. And when I was talking to them, the funding was tenuous for these things that were effective. Well, so it's the same shit, just a different place, right? It's like, yeah, they've got something great that works, looks phenomenal. They do this, this, and this. And their funding might not last, right? And
all right. Well, but they've got. Listen, getting a medical detox bed right now is not easy to do in Toronto. So
you keep making these statements, and then I'm like, is it that hard? Like,
yes,
yeah.
You want to tell me how to do it?
I don't know. I just if they get a regular detox bed and they see me, I can just give them the meds there. Well, that
doesn't make it a medical detox. That means you're getting them a script in a detox.
If they go home and their mom's there, I could have their mom hand them the meds every few hours.
So when I'm talking about a medical detox, I'm referring to an inpatient stay where somebody who's, for example, withdrawing on non-palatables, which we know can be very dangerous and has a profound seizure history.
Yeah, for them, I think you have to almost coach them on to be enough withdrawal that when they go to the hospital, they'll score on the scale. And then you have to beg them, just don't leave, please don't leave to drink the non-palatables. And then if they stay there for those 8 hours and they shake for those 8 hours and finally the team notices and then they start the treatment and they don't undertreat, the person might get the full withdrawal management.
They might, but some of these stays require multiple days, like to do safely.
Well, CAMH can do the first day. So you go to the withdrawal to CAMH, they'll keep you for 24.
Which program is that?
Just the emerge.
Okay.
They do 24-hour emerge. So with Portugal.
So I'm glad that somebody's getting it, even if their funding's about to be cut. It's more than what we got right now.
But it's not full medical withdrawal. It's just some. I mean that's what I mean. They're covering
a hospital that's willing to accept them in and give them some care.
Yes, that is correct.
For now,
I will not work for that. But I think it's just I don't know. It's they don't seem to have so much of a I don't know. I just they're so nervous about fentanyl coming to Portugal. They're so grateful that it's not there yet, and they don't know what they'll do when it comes. And when I think back to like 2016, when those overdoses were starting for at least what you were seeing in the shelters, and what I was seeing in the hospital, they're probably happening earlier, right? They're probably happening earlier than 2016. We weren't sure what to do then, and we're still not sure what to do now.
Well, hopefully they don't have to deal with that. But if they do, I'm sure that they seem to, they'll have to do like everybody else, like we do every day, and figure it out somehow.
Yeah, and I think with some of the philosophies of care that have been helpful over the last 2 decades, being one of the first places to decriminalize, I think they have a good chance of success. I really believe so. Like,
if anybody does, I think they do.
Yeah. And they just the people here are great as well. So I shouldn't say that, but it was just so great meeting those people and hearing what they did and how they were adapting at different phases and the different stuff that they built and developed. It was just very inspiring.
Well, that's very good energy. Great. Thank you for being our roving reporter, traveling halfway around the globe to Portugal.
Well, keep in mind, I'm of the privileged class. I was going on for a friend's wedding.
So we won't be able to write this trip off in the out of the proceeds of our huge podcast revenue.
Oh, we did get 20 views. I think we were at 25. I think we were at 25 for the last one. 25 for the last one.
Let's keep it rolling.
Keep it rolling. People need to hear what we're saying.
Message,
They want to hear this message. We want to share this message.
Awesome. All right. Okay. Thank you so much.
See you soon.
Thanks for watching. If you like what you saw, please feel free to like and subscribe. That way you'll get notified when we come out with new content. We try to come out with new content about every week or so. So anyway, thanks again and see you soon.